Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. And on these weekly mini episodes, we bring you bite-sized ideas for you to snack on.
Like breathing exercises, book reviews. Maybe we'll review some scientific research, or we'll share some wellness and fertility stories from our listeners.
So if you're looking for a tip or a trick related to your fertility and well-being, then you've come to the right place.
Let's dig in.
Welcome back to the Whole Pineapple Snack Edition. We are so pleased to welcome back Dr. Lee Hullender Rubin, who talked with us all about acupuncture last week. Hopefully you tuned into that, and is back to focus today on a little bit more of the hot topic of what about Chinese herbs, or what does it mean if someone wants to add Chinese medicine, traditional Chinese medicine? How can this be something that you might want to incorporate with your fertility plan? And also maybe why has your fertility clinic told you they don't want you to do it? So,
yeah, we get these questions a lot. Yeah, welcome.
A lot.
Thanks for having me.
So what does it mean to say that something, or that a provider practices Chinese medicine? Tell us, big picture view, kind of what does this encompass? Because it sounds like it can be a whole lot of different things.
I think this is a great question because Chinese medicine really is from China. And I owe everything that I know to Chinese scholars and to my Chinese teachers actually here in the United States. And it's a privilege for me to be able to practice this as a non-Chinese person. I speak very poor Chinese, unfortunately. I did study the language, and so my tones are always less than excellent. But when I think about Chinese medicine and how I would frame it for someone who doesn't know much about it, it can be part of an umbrella of multiple countries. So you can have Japanese acupuncture and Kampo herbal approaches. That's also a Japanese herbal approach. You could have Sa'am acupuncture, which is Korean. There's another type of Korean acupuncture called Koryo. There's Vietnamese, there's others. There's so many different styles and approaches, and they all get kind of lumped into Chinese medicine. But to be more, I think, authentic or more inclusive, I might choose the term East Asian medicine. That's mostly what I would call it. But when we think of the whole system of East Asian medicine, acupuncture is just one part of it. It's the most popular one. It's the one most people know. Gua sha is another thing that's having a moment on Instagram. If you just do hashtag Gua sha, GUASHA, you'll see all kinds of people using tools on their faces and on their necks and stuff. It's really excellent.
What is gua sha? I don't know what it is. Is it like a roller or what?
Yeah, well, the roller is part of it. Gua sha is a tool that you use on your skin. It's like it scrapes the skin to create redness. That's literally what gua, scraping, sha, redness is. So you can use it for like facial stuff or cosmetic reasons. You can use it for pain. You can use it for if you have a fever and you're trying to get blood to the surface to help vent it, as we would say in Chinese medicine, to help you cool off. Okay, so that's one other modality within the whole system. You've got cupping, which I'm sure you've seen, pictures of swimmers with these purple little perfect round circles on their back, which is a way to help deal with pain. And Chinese herbs are in there too. Chinese herbs are part of a culture of care that includes both foods and roots and, minerals, and there's some animals in there too, animal parts. So it's a broad materia medica is what we call it, or pharmacology of lots of different medicinals for the intention of helping to support people based on Chinese medicine. So you said, what does it mean to talk about it in this way? It means that we're using whatever we need in our toolbox to help you achieve your health or wellness goal.
There is a term that's actually in your bio. It's integrative medicine. Yes. And that, I think, is like the goal. The U.S. is a little bit far from that goal right now. But tell us a little bit about what integrative medicine is.
Integrative medicine, I think its ideal situation is where we all collaborate together in support of patient care, where all of us in our specialties, whether it's interdisciplinary, so whether it's nurse practitioners who specialize in reproductive medicine, physical therapists, maybe who specialize in pelvic floor physical therapy. It's us as acupuncturists. It's a therapist who is also helping with the mental health aspect of the process, where we all collaborate together to support patients through their process of building their family. So Integrative, though, while it's a beautiful term, I think I actually in practice very often, we all are still in our silos and we don't really always understand each other. And so the collaboration can sometimes get stilted. And that's just a really honest assessment of it. I think all of our intention is to try to be as collaborative as possible, to speak with one another if we need to. If I had a patient that was at your clinic and I had a question about something and I wanted to maybe add in Chinese herbs, I might call you, Ruby or Ann, and say, hey, I have this patient. They're not taking medications right now. They have diminished ovarian reserve. They've had 3 failed cycles so far in the sense of they have not responded to the medication so far. There's been no eggs retrieved or maybe no embryos resulting from it. What do you think about us adding in Chinese herbs now? And then I would want to talk to you about it. And then your question might be, well, what's the evidence? And I might say, well, what we know is that there's not a lot of evidence around this. We're relying on the classics of Chinese medicine and how they treated fertility for people. They were talking about premature menopause in 600 BC. Like they were already writing about what this looked like from their perspective in earlier times, they being the Chinese scholars. So ultimately, if we can collaborate, we can talk and understand one another and help us also choose the best time to incorporate things, make it safe, make it agreeable in the sense of the patient also is interested in doing this. It's not us coming at them and saying, you have to do X. It's driven by all of us in a collaborative way.
You know what just made me really happy is when you're listing all the integrative providers. We're of course, here we go. We got nurse practitioners. We've interviewed a pelvic floor physical therapist. We've interviewed, yoga, and we have Jamie, our lovely counselor. So I'm like, oh, I love this, our little integrative podcast.
Well, it's so interesting, as you said, to think that you had these, thousands of years of tradition. And why do you think it is that, herbs remain kind of robust part of a lot of East Asian systems, but just did not become part of it here in the US? Do you have any theories or?
Well, I don't want to speak for anyone other than to say that, Chinese herbal medicine is culturally embedded in the fabric of their lives from the way I understand it. And I don't want to misrepresent Chinese culture because I'm not Chinese. I am a Hispanic white woman. I don't know all of the details. So I want to be clear that I don't mean to represent anyone here. My understanding is, though, that Chinese herbal medicine includes many foods. It includes medicinal herbs in the sense of things for spices are also part of the Chinese herbal pharmacology. And so I think it's just been so deeply ingrained in the culture there that even today, you're going to see what people are told, hey, add this to your chicken soup and it will help you feel a little bit better if you have a cold or whatever.
I love that. When I was working at the hospital, labor and delivery, I'd see all the this is for in labor and this is what you're supposed to drink after birth. And, people would, even if they didn't practice a lot in their daily life, it was one of those things where, because pregnancy for many people does make you feel more connected generationally too. I had people being yeah, my grandma said I had to drink this, so I'm bringing it in, even though I don't know if I really need to. But yeah, it was interesting to me to see people feeling that kind of cultural connection to something that's been done for a very long time.
And has been effective for them, right? Mm-hmm. And it's been documented for thousands of years. Now, are these randomized control trials that have been documented for thousands of years? No, they're often cases. And they often were testing things on themselves and saying, okay, well, I noticed that my foot hurt. I used this herb to take it to my foot. It helped. Or this one didn't work. And they all wrote it all down for all of us to benefit from. Well, those of us that study Chinese herbs anyway. The research that I know about right now is that it is very challenging to research Chinese herbs. But let me just give you an example why. Let's say you're not sleeping, okay? And there are at least 5 different formulas, all with different herbs, all of different sizes of formulas. Some have 5 herbs in them. Some of them have 15 herbs in them. You can imagine that also, I'm getting a little bit better, but I'm noticing as I'm sleeping, I'm not sleeping as deeply. I am falling asleep okay, but I'm not sleeping as deeply. So then we might make an adjustment to the formula. It is very challenging from a research perspective to not only investigate a complex multi-ingredient formula, but then to also account for changes in it, the dynamics of it, being adaptive and responsive to what a patient needs. That's really hard to do in research. And then to also have a control for all of that too.
So why do you think a lot of clinics advise against herbs, at least in their IVF patients?
I think it's because we don't know what it's like when, at least here in the United States, I do understand in China that they do add Chinese herbs during the IVF process when people are on stimulation medications. But we don't have a lot of well done research where that's, when I say well done, I mean like things that have been published in like, let's say fertility and sterility or something like that, where we have clearly seen a particular formula improved outcomes or didn't, that no, we're not seeing that kind of literature.
I know one year at ASRM, I was like, oh, wow, one of the, abstract talks, it's on herbs and Chinese medicine. And I was like, great. And I sat and I had to sneak out of the room early because I was like, I don't even know the names of what they're like talking about. And they're just kind of really quickly reading through. We did this and then we tried this herb and that herb. I was like, oh, this is like way above my level of understanding. And you're right. It's so hard when you're trying to standardize something that in some ways just really can't be standardized because you're trying to tailor it a little bit more to how the person's feeling too, right? If you're trying to mix different combinations of herbs based on what the goal is in that particular patient in that particular time of the cycle.
Precisely. And the additional thing about research for specifically like substances is we really like to narrow it down to like one thing.
Yeah.
Is there one thing in this whole formula that is the thing that's the active ingredient? But what we're finding, because there is some research on herbs and like dermatology and herbs and digestive disorders like IBS and IBDs, but we cannot reduce a formula of 15 things into one particular constituent because you want the synergy. From the way I understand the research, you want the synergy of all the herbs working together in order to achieve what you need to achieve.
It's like the story of the blindfolded men, and they're all touching a different part of the elephant.
Oh, the elephant.
Yes.
And they're like documenting what they're experiencing and what they think it is, and then like full picture, it's like one thinks it's a rope, and one thinks it's a tree because of just what they're experiencing, and then you like blow it up and it's actually an elephant, but they couldn't tell because they're just looking at their one siloed ingredient, I guess.
Or you look at last week, right? Like you're having this guidance that actually this decongestant doesn't do anything. You've got to pull from the shelf the cold medicines in, but that's been for years. I mean, it's so hard. You have a combination medication, and how do you really know what quote unquote active ingredients are the important ones and what are probably not? So yeah, I know our clinic does what I think is pretty typical, where we say that if people have been taking herbs and they want to continue, we're usually fine with that when they're trying either with intercourse or inseminations. But if they move on to IVF, that's often when we do say we prefer not. And I think it's because of that uncertainty, because there's that theoretical concern that herbs might influence how their body's going to absorb the injection medication. And when you're spending that much money for something, that's when I think we get concerned that we don't want to do anything that might negatively impact the outcome. And so at least in our clinic, I think I see the times we do it are kind of like that patient you explained, someone who has diminished reserve. We're kind of getting poor outcomes no matter what we're doing. And so if this is something that might potentially boost it, that's where we're not as concerned that it might diminish. We're more like, well, there's a lot of stuff out there that we can't completely explain. Why not give it a try and see what it does? Are there patients that you are more likely to have that conversation to kind of like advocate, hey, I think maybe you should talk to your clinic about whether herbs could be helpful in your cycle?
Yeah, I mean, I think you touched on a very important thing is like you have a demonstrated response. So if we know someone doesn't respond well, that is a sign that, okay, maybe this could be safer. But if I don't know how someone is going to respond, it's not appropriate for me to add in Chinese herbs yet. We don't know what's going to happen once you add in Gonal-F and Menopur, and maybe you take Antigon on top of that or something, whatever the type of cycle that you're doing. It is so expensive. The medications are so expensive. You're not only spending money, you're spending capital from your heart, right? Like this is so hard. I want to make sure that I'm supporting you in the ways that I know will definitely support you. And I'm not sure what's going to happen when you take your medications. If you hyperstimulate, I don't want it to be because of the Chinese herbs.
Yeah.
There is a
Yeah.
risk of that in certain cases. So I train this of other acupuncturists when I do teaching, and I practice this in my practice, is that if we want to know how you respond first before we're going to add in Chinese herbs. So you're going to need to go through 1 to 2 cycles. If you need to do that, maybe you don't need to do it. But if you do, we need to know it's safe for us to proceed with that. Secondly, for people who are much older, so for people who are 42 and older, and they have an FSH, or rather an AMH that's less than 1.2, or even less than that, maybe even 0.7.
Hey, that's
Um,
mine.
yeah, right. That doesn't mean you can't get pregnant, right? Like there's
No.
the data on that too. But I'm going to be looking at parameters. Like if you have a really high antral follicle count, I'm not going to be putting Chinese herbs into the mix with your gonadotropins. That's just not a smart thing to do. And I'm going to talk to the doctor. Even if we had the scenario where someone has gone through cycles, it hasn't been to the level that they've wanted to, they haven't gotten very many embryos. If the doctor still is like, no, I'm actually going to defer to the doctor, because you're the one that's managing, the doctor who's doing the IVF cycle. I'm going to follow what they're doing, because they're the ones that's really governing what's happening with, like, how many units of Gonal-F am I going to give this person? If they go really high, like, what am I going to do with my Chinese herbs? I don't really want to be messing with that. I want to let you do what you're doing and not get in the way.
This is kind of a silly question, but like, how does one take herbs? Is it like a pill? Do you make a tea? Like, how are you actually consuming?
That's not a silly question at all. There's so many ways that you can take Chinese herbs. There's actually the raw bulk, where you literally see the sticks and the parts of the roots and other aspects of the plants in a bag, and you cook it in hot water for like 60 minutes or something like that, a couple times. And I usually have someone cook it for me. That's one way to take it. You drink the liquid.
Okay.
Someone cooks the herbs. You can do it at home. It's very fragrant. Some people really like the smell. Some people don't. There are powders that are the herbs that have already been pre-cooked and then sprayed onto like potato starch or something like that. And it dissolves like Senka. I don't know if anyone here knows what Senka is, but it's like an instant coffee.
Yeah.
So you use herbs in a similar way, where you'll take a couple scoops and put hot water in it, let it dissolve, and then drink that. Another way you could do it is actually with capsules or tablets that are pre-made formulas that are then made into tablets or capsules. Another way is actually with herbal extracts, where the herbs are extracted and then put in water and a little bit of alcohol.
Wow.
Lots of ways.
Lots of ways. Yeah.
Is there specific ways that are that are more appropriate for certain scenarios?
Yeah, there really are. So if you want the most potent, the strongest herbs, the raw herbs that you have cooked or you cook yourself is thought to be the most effective. I use that a lot, especially like with long COVID people or people who are really, really, really sick, who really need powerful herbs. People with endometriosis related pelvic pain, that's very severe. I might use that as well. The herbal extracts are really great for digestive diseases, to be really honest, and for upper respiratory things. Like if you get a cold or a flu, they're really great to kind of kick it out faster. Then for everything else, the powders and the granules can be really a great way to conveniently get herbs. If you don't have time, you don't have time to cook, or you don't want to cook it, you don't want to deal with that. Powders are a really great way to conveniently get the herbs. It's shelf stable and it'll last for a while.
Where do you as a provider get your herbs? Like, how do you know that you're getting what you need?
Ooh, that's a good question. Yeah.
It's a great question, actually, because, it is possible to get things that are not high quality or that may be contaminated. So there's 4 or 5 companies in the United States that import herbs, and then they test them independently. And they also do like good manufacturing practices if they're going to create them into powders and granules, or they're going to create them into the extracts. The ones that do the bulk herbs, they have them tested as well for heavy metals and toxicities of any kind, for pesticides, for any kind of thing that would actually be not great for our systems to be absorbing. There are some places here in the United States who are doing organic growth specific herbs and making those available for herbalists. I do not have a pharmacy on purpose. I actually like to have my powdered herbs, and for raw herb formulas, I send them to a pharmacist and they fill it for them or cook it for them. And I try to stay out of that. But other people have them themselves and they are certified to do that. It's it's more work than I want to take on right now.
Well, that's such a good question too, because we talk about that a lot with people's supplements. Like, it does matter where you get your supplements. You want to make sure that you're looking at that it's like attested and controlled. And, they are testing for things like pesticides and stuff that you don't want to be putting in your body.
The FDA does not have a ton of oversight over nutritional supplements, for one, over Chinese herbs, which fall under nutritional supplements. So we really do understand we have to step up and put in those extra steps to keep people safe.
And so at the end of the acupuncture episode, you mentioned like how to find a licensed provider. What about finding someone that is, appropriately using herbs? How do you go to find somebody? Do you pretty much look for an acupuncturist and ask them? Or are there people that specialize really just in the herbal side?
There are people who just specialize in the herbal side. There is no formal licensure just for herbalists. So this is kind of a complicated answer. So bear with me for a second. In certain states, you do have to study both acupuncture and Chinese herbs in order to get licensed in those states. California is one of them. In other states, you just have to study acupuncture and then you can study herbs optionally. It's up to you. What we do have is a national board certification where you can take this test that demonstrates that you have studied herbs. You have taken all of the classes for understanding what each individual herb is, what I think over 300 formulas are. I can't remember the numbers now. It's been it's been so long since I took the test. And then you also need to be able to learn how to combine it, how to dose it, how to, preparation is part of it, but then safety. How do you not combine herbs that will cause harm? And then how do you choose specific modifications? Like you really do need to have a pretty in-depth understanding of how to do Chinese herbs. Now, not everybody has to also do that test. We recommend it. And for those of us who are Chinese herbalists who are really committed to this practice, we do lots of continuing education. I was actually just in Los Angeles 2 weeks ago studying with one of my favorite teachers about thyroid diseases with Chinese herbs. I think for those of us, this is just me thinking, okay, so this is my opinion. My opinion is those of us that are really committed to Chinese herbs are very interested in continuing our education, getting better at what we do, doing it safely and doing it effectively.
And we're kind of on the line of safety. That kind of brings up an important thing on the patient side, that you want to make sure you're telling all your providers, your IVF provider, everybody that you are trying to get pregnant, because there are certain things that you do not want to be doing when you're in the trying to conceive or pregnant side of things.
Right. And like assessing liver function, assessing kidney function before I put something on Chinese herbs. I always ask people to go get their labs done before we start doing it, just to make sure that everything is okay there. And we can track it if it's something that I know we need to track. If their kidney function and their liver function are okay and we give them herbs for a little bit, I might have them go back and do it again just to make sure everything's okay.
And that's perfect, because I think sometimes patients don't think to tell us what they're taking, or they might go to their primary and they say, oh, what are you taking for vitamins and supplements? And they don't think of the herbs in that same category. So yeah, we definitely always want to know what people are on. And this has been great. I think this answered so many good questions about what herbs are and why you might want to consider. I learned a lot too. And that safety component. I hadn't really thought a lot about that, but that's huge. So
it is huge, very huge.
Ruby, any final questions?
No, I want to learn more.
I was just say, don't you want to go home and brew up a really
I was just looking because I have my tea station behind me. I have my tea crystals and stuff. So I'm like, that's sounding kind of good right now.
Well, a really easy tea that you can make right now, if you have a little bit of nausea, let's say you're in early pregnancy, and your sushi, you often get something called shiso leaf, and you mix that with a little fresh ginger. That can actually be really good for settling your stomach.
There you go. I'm going to use that now.
I know, right?
Well, thank you so much. This has been lovely. We really appreciate your time and all your expertise, and we're so glad to have you as a resource closer to us now. So
thank you. Thanks so much for having me and being interested in this really great topic.
Definitely. And we'll post your info in our show notes. But how can people find you if they want to just learn more about you and what you do?
Yeah, you can come to my website at rosefinchhealth.com.
Perfect. Thanks so much. Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review the Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.